Hi everyone, it's January 8th, 2026. Happy New Year and welcome to the first monthly Dr. Fox live Q&A where we answer all of your health questions live. My name is Abraham. I'm an advanced medical practitioner and pharmacist and the lead of the YouTube channel here at Dr. Fox, an online doctor and pharmacy where we create science-backed content focused on your health and well-being. We go live every first Thursday of the month. So please mark it in your calendars. We're going to dive into your questions. Just a bit of housekeeping before we go into all of it. All the questions I answer in today's video are submitted by viewers like yourselves through our comments and through our social media. So if you have any health questions, just drop a comment in the comment of this live show or on any of our videos. And if I have time, I will answer it in this episode. But if you leave a comment later on after it's gone live or on another video, I will answer it in next month's episode. Also, just to make you aware as well, I have two tabs open. So if I don't respond to your comments straight away, just bear with me because when I flick back to the tab on the YouTube live, I'll be able to see your comment. All right, so please leave us a comment. I can see the chat is pretty clear at the moment. So without further ado, I'm just going to get rid of this and we're going to move straight into the first comment. All right, so this comment is from JCP633. What causes male pattern baldness? I really like this question. So male pattern hair loss is commonly caused by genetics and a hormone called DHT in particular, and it stands for dihydrotestosterone. So most men, they produce testosterone, but in people who are genetically prone, some of that testosterone is converted to dihydrotestosterone, the DHT, and they have sensitivity to this DHT. Their hair follicles have far more sensitivity compared to people who aren't genetically prone. So what DHT actually does is it gradually causes the hair follicles to shrink over time, and we medically call this as miniaturization. So the follicles shrink, hair growth sort of thins, the hair starts to thin, it starts to weaken, it gets shorter, and eventually it stops growing. The main part that's affected by DHT is our front hairline, the crown, which is where we see, that predictable pattern with male pattern baldness. You'll often notice actually, excuse me, that the sides and the back of the head usually stay much thicker in male pattern baldness. And that's because these hair follicles are actually resistant to DHT. So they're genetically programmed not to respond to DHT. So they continue to grow normally. And this is why often actually in hair transplant procedures, for example, they commonly harvest hair from the backs and the sides of the hair, which are DHT resistant, and then move them to the transplant area. So genetics play a really big role, but when hair loss starts and how fast it actually progresses, it can vary a lot. Other factors also like stress or illness can increase shedding temporarily, but they don't cause male pattern baldness itself. The underlying driver is still that DHT that we've spoke about in a bit of detail, acting on genetically sensitive hair follicles. So the key takeaway is male pattern baldness is biological, it's very common, it's progressive, but understanding the cause is what allows treatments to work best, really, especially when started early. Excuse me. Of course, if you are struggling with male pattern baldness or any hair loss, you should always speak to your medical provider. So I hope that was helpful, JCP633. I'm just going to quickly flick onto our other page, just make sure there's no comments coming in. So we're looking good. I'm just going to move on to the next comment. Just remember, guys, if you have any comments, please feel free to leave a comment on this video whilst I'm going live. I will try my best to answer it. All right, let's flick on to the next question that we've got from Emma1919. So what helps prevent thrush from coming back? All right, so this one's from our social media. So preventing thrush from coming back is mainly about reducing the things that allow yeast to overgrow. All right, so one of the most important steps is completing a treatment fully. So if you're prescribed a treatment, you must complete it fully. And I've seen it so many times in practice where patients are given treatment and the symptoms improve and they stop too early, and then it allows the yeast basically to survive and to come back again. So that's a really crucial step that a lot of people unfortunately miss. Other things in terms of preventing it from coming back, excuse me, keeping the area cool and dry. It can also, make a big difference. Loose fitting clothes are actually quite helpful, and breathable cotton underwear. It can help reduce the moisture, which basically yeast and fungus, it basically thrives on that environment. Avoiding unnecessary irritation is another key step. So scented soaps, bubble baths, vaginal washes, and douching, they can disrupt the natural balance, and they can basically increase recurrence. So also, just bear in mind if antibiotics are ever needed as well, be aware that they can sometimes trigger thrush. So it's helpful to know that in people that are quite prone to recurrent thrush. Extra care, especially during and after antibiotic use, can reduce flare-ups, but obviously make your medical provider, your healthcare professional aware of that. And managing underlying factors is also important. So stable blood sugar levels, for example, especially in diabetics, can help limit yeast growth. Hormones can also play a role too, actually, thinking about it. So some people notice more thrush with certain types of birth control or even hormonal treatments. So if that, that is yourself, make sure you speak to your medical provider about it. But it's also important to make sure that symptoms really are thrush each time, and repeated self-treatment for the wrong condition really isn't going to prevent recurrence. So the key takeaway is preventing recurrent thrush is about protecting the natural balance and reducing moisture and irritation, addressing those triggers that we spoke about. But most importantly, if you're having ongoing thrush, you really need to speak to your medical provider about it, make them aware of it, and get their expert input. All right, we're doing well. We've got some good number of viewers on at the moment. Chat is looking clear. So I am just working through, guys. So again, I'm just going to, whilst I take a sip of my tea, if we have any comments, please feel free to join in. Okay, let's move on to our next comment from Scooby Steve. All right, I really like this one. So what can I do to get rid of bloating? So getting rid of bloating. So it starts with reducing the gas buildup and easing gut sensitivity. One of the simplest steps is slowing down how fast you eat, okay? If you eat quite quickly, it means you're swallowing more air, which can directly increase bloating. Another thing that I recently learned about as well was if you're using straws to drink fluids, straws can actually make you swallow a lot more air. So that's something to bear in mind. If you are someone that always uses straws and you're always feeling bloated, could that be contributing to it? Also, chewing gum, that can also make you swallow more air. So doing things that can directly reduce how much air we're swallowing may help. Other things that can help that come to mind, portion size matters too. Large meals often stretch the gut, which can worsen bloating, especially in the evening. Smaller, more frequent meals are often what we say are easier to tolerate. And certain foods are common triggers, okay, like foods that are high in fermentable carbohydrates, like onions, like beans, like fizzy drinks, like some processed foods as well. They can all increase gas production in the gut. Carbonated drinks are a big one. We've sort of touched on that. The gas doesn't disappear, you see, when you're having these carbonated drinks. It just stays in the digestive system and it causes that tight, swollen feeling of bloating that no one likes. Another thing that comes to mind as well is constipation. It's another common cause of bloating. If stools are moving slowly and they're trapped in your gut, gas can get trapped behind it as well. So regular bowel habits and adequate fluid intake and gentle fiber adjustments can also help reduce bloating. Stress is also a big role, plays a big role in it. More than most people realize, the gut is highly sensitive to stress, and tension can actually slow digestion and increase bloating, even without any food trigger. And the thing about the gut, you need to think of, it moves like this. So if this is your gut in a tube, it's moving like this, and it's slowly moving things across. So all of these things can affect that tension and the movement, especially stress. Now, movement is one that I don't think is spoken about enough, and it's something that I often recommend to my own patients. And light activity, for example, like walking after meals, encourages gas to move through the gut instead of building up, and it can be really, really helpful. It's also important to notice patterns. Bloating after meals can point to digestion or food triggers, whilst bloating later in the day can often relate to gas accumulation rather than fat or weight gain. So the key takeaway is bloating is functional and it can be reversible. There's things that we can do that we've discussed, but if you're struggling with bloating and it's happening constantly and often, and you haven't made your medical aware of it, please do so, because it is very important. I'm just going to flick tabs again and make sure we're doing okay. Okay, so we've got a comment actually. Let's move on to the comment here. All right, from Lady HE2I. And I can see you're wearing a white coat, so probably a medical health person. So, hi, do women's probiotics help with thrush? This one's a bit of a debatable one. So there is some evidence that does support it. And there's also evidence that shows that it's not very valuable either. It does depend though. So for example, sometimes when antibiotics are prescribed, it is sometimes recommended to then take probiotics to actually help reduce the occurrence of thrush. Obviously, this is something that your healthcare professional would have to recommend to you, but for some instances, that has been shown to help. But just taking probiotics, for example, because some patients just take probiotics because they've heard online that they can be very good for you, and they're helping with your gut biome, as everyone likes to talk about. Well, just by taking a probiotic, the evidence is highly debatable whether that actually helps. So I hope that is useful for you, and it helped answer the question, Lady H. Okay, we've got another comment. Wow, thanks guys. I'm really enjoying these comments. Thank you so much. All right, moving on to the next comment from SCP-731. Question: how effective are water fasts for weight loss? Water fasts for weight loss. Well, fasting for long periods and doing very, very strict dieting, it can actually be quite dangerous as well. So it's always recommended to involve your healthcare professional, when you're doing a diet, to actually go through what you're eating, discuss, what you might not be doing right, what you can improve on. And just doing a water fast specifically and not eating anything else, it can sometimes actually have its downfall as well. And also putting that much stress on the body, because that's when your body under a lot of stress, it can then cause other problems as well. So it's really important, if you're trying to lose weight, to look at the NHS resources as well. There's lots of really helpful tools online as well, what you can do that can help to lose weight, but doing it in a safe, effective way. So I really hope that helps. Okay, great. Thank you so much for your comments. I'm just moving back onto our previous comments that we are working through. So, excuse me, this comment comes from Alex. Does birth control affect fertility long term? All right, this is a great question, and I get asked it quite often actually in practice. So, in short, no, birth control does not affect fertility long term once it's stopped. Most types of birth control, they work by temporarily preventing pregnancy. They stop ovulation, they can thicken cervical mucus, they can thin the womb lining, for example. And these effects only happen whilst you're using them. So once birth control is stopped, your contraceptive pill is stopped, fertility usually returns to what is normal for that person. Now, for methods like the combined pill, the mini pill, implants, coil, or the vaginal ring, fertility often returns within weeks to a few months. But periods can be irregular at first, just bear that in mind, but that doesn't mean that fertility has been harmed. But there is one important exception that I wanted to discuss, actually, thinking of that. The contraceptive injection, it can cause a delay in fertility returning, all right? So for some people, it can take up to around a year for normal cycles to come back. So that's the contraceptive injection. That delay is temporary, and it's not infertility. So that's a really important thing to remember. And another key point is age, actually, thinking about it, because many people stop birth control later in life, and fertility naturally declines with age. And that decline is often blamed on contraception, but it's actually due to the normal age-related changes. So not the birth control. So that is the key takeaway here. Reversible birth control, it doesn't cause infertility, so fertility returns upon stopping, sometimes quickly, sometimes with a short delay, depending on the method. Obviously, if you are having any fertility issues, it's really important that you speak to your healthcare professional. All right, I'm just going back onto our stream page. Lady HE2I, thanks for answering. Well, you're so welcome, and thanks for being one of our first comments actually on our first live stream. It's really fun doing the lives. It's one of my most favorite bits. Just to let you all know as well, on the Dr. Fox channel, we have daily health videos, so make sure that you subscribe so you see all of our daily health videos, and we cover a range of topics from erectile dysfunction, premature ejaculation, to hair loss, to birth control, to stopping your period, you name it. We've got all the topics covered. And it's all coming from a medical professional, so you can trust the information. So I really hope that you find it helpful. I'm just going to flick back over to our comment section. I've got another comment left. So if anyone has any other comments or anything they want some information on, if I have time, I will try my best to answer it in this episode. So feel free to leave a comment. So I'm just going to flick my screen now and go back to the comment that I was going to answer from John92. So this question is from John92, and it is, what is considered premature ejaculation? So premature ejaculation is usually defined by how quickly ejaculation happens and how easy it is to delay it. So on average, the typical time from vaginal penetration to ejaculation is around 5.7 minutes. Now, premature ejaculation is generally considered when ejaculation happens much sooner than this, often 1 to 2 minutes, and it occurs most of the time, by the way. That's also important to remember. Now, instead of focusing only on timing, which is important, what also matters is control. If ejaculation happens sooner than intended and is difficult to delay, then that's when it's considered premature. The definition is based on consistency over time, not a one-off experience. That's really important to remember. Now, occasional early ejaculation is very common, and it happens to most men at some point. The key takeaway is that premature ejaculation is about timing, control, and brain chemistry, not a personal failing. So it is really important, though, if you are struggling with premature ejaculation, to speak to your medical provider, as there are many different options, and they also need to have a consultation with you to really find out what's going on. Just going to flick back over and make sure we are doing okay on the comments. Oh, thank you so much, SCP-731, for subscribing. I'm glad that my answer was really helpful for you. Okie dokie, just flicking back here now. Just give me 1 second, because we have this like really nice page and spread that I have to click and have these nice little things come on screen. So feel free, if you want to share our channel to any friends and family, if you found this helpful, feel free to take a screenshot, and then you can take an image of this QR code as well to subscribe to us. I just want to say a massive thank you for everyone that's tuned in on our first ever live show in 2026. The channel started a couple of days ago now. It's gone live, and we're going to have daily health videos, like I said. If you're watching this video after it's gone live, please do not worry. We have new episodes or new live Q&As every first Thursday of the month. So if you want to come online and have a chat with me, please come and join us. Or also subscribe to the channel so you're notified when it's going live, and also to watch our daily health videos. And also, if you leave a comment on any of the other videos that come out, they're all noted by our team, and it will be added to my list of questions that I answer in next month's episode. So you don't need to remind us or anything like that. Please subscribe to our channel. And as we always say, Dr. Fox, discreet care delivered direct to your door. Thank you so much for watching. I hope you all have a wonderful day, and take care.